Hi, I'm Juliana. I'm going to be your student nurse today. Can I have you confirm your name and date of birth for me?
Kaylin Joyce, 12/13/02.
Perfect. And then I'm going to be taking a video for a class today. Is that okay?
Yes.
Okay, thank you. All right, so I'm going to be doing a abdominal exam today. It should take about 10 minutes. There'll be some listening to your bowel sounds, palpating your stomach area. That's pretty much the majority of it. So before we get started today, are you having any pain, any nausea, any issues with urinating or bowel movements?
No.
And when was your last bowel movement?
Last night.
Perfect. So the only other thing I have to ask you before we get started, have you gone to the bathroom like recently, or do you have to go before we?
Yes, it's been recently.
Okay, perfect. Okay, so then I would note patient is sitting upright, patient is alert, awake, skin appears to be intact with no signs of cyanosis or pallor or any lesions, and patient appears to have good hygiene. Next thing I would do would be taking her vital signs, so I would find her radial pulse, which is right there, and I would assume it would be somewhere between 60 and 100. And then I would evaluate her respiratory rate, so looking for her chest to rise and fall. I would take for another 30 seconds and multiply by 2, and I would expect it to be between 16 and 20 breaths per minute. So now that we've done that, I'm going to position the patient. So can you just put your feet up on the table for me? Perfect. So skin is symmetric. I don't see any signs of hernias. Contour appears flat in the stomach area. No pulsations, no dilated veins. So the next thing I'm going to do is listen to your bowel sounds in all 4 quadrants. So I'm going to start in the right lower quadrant, which is going to be right here. And then I'm going to move to the right upper quadrant, in the left upper quadrant, and the left lower quadrant. There are active bowel sounds in all 4 quadrants. Ideally, we would do that directly on the skin, but due to patient comfort, I'm doing it over her clothing today. So next thing I'm going to do is I'm going to listen to those same 4 abdominal spots with the bell of the stethoscope, listening for bruits. So I'm going to start with the aortic. And then I'm going to move on to the renal, and the iliac, and femoral. And there are also no bruits present. So next thing I'm going to do is percuss all 4 quadrants, starting in the right lower, right upper, left lower, and there is tympani in all 4 quadrants. So next I'm going to palpate lightly just for pain. So can you tell me if you're feeling any pain?
No. 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 No.
And then I'm going to palpate a little bit deeper just for rebound tenderness. You're going to feel a little bit more pressure this time. And there's no rebound tenderness. So now I'm going to palpate in the right upper quadrant for the liver. So it's going to feel like I'm hooking underneath the ribs just a little bit hard. And I cannot feel her liver, which is good. And next I'm going to palpate the kidneys for tenderness. bilaterally. So that's gonna be here. Any pain?
No.
Okay. So there's no tenderness in the kidneys. And that is all I have to do for today. So do you have any questions for me before I go?
No.
Thank you for being my patient once again.